Hi, my name is Audrey Grice, and I'm doing my presentation over Sanfilippo syndrome in early childhood. So first off, what is Sanfilippo syndrome? This is a rare genetic neurodegenerative disorder. So an estimated 1 in every 70,000 live births will have Sanfilippo syndrome. This comes from Sanfilippo's Children's Foundation website. So this is caused by the body's inability to break down complex sugars, which leads to a toxic buildup in the cells. So basically, when those affected by this disorder have these complex sugars, which are naturally produced by the body to aid with cell signaling and tissue structure, their bodies lack the enzymes needed to break it down properly. This leads to the toxic buildup in the cells. So they keep producing these complex sugars with no way to dispose of them. So the symptoms usually become noticeable between the ages of 2 to 6, which makes this specific to the early childhood life stage. So there's 4 different variations of the disease, but their severity and rate of progression are the main differences between them. So type A is the most severe form with rapid progression of the symptoms, and then type B is similar to type A but has a slower progression of symptoms, and then type C is slower than both A and B. And then lastly, type D is the rarest form, and it is considered mild with a slow progression rate. So, causes of Sanfilippo syndrome. So, it's an autosomal recessive genetic disease, which means that parents both carry a recessive gene for this trait. A book written by Hall and Henderson Laidlaw in 2019 described it as a progressive and rare congenital lysosomal disorder that is caused by an enzyme deficiency in the degradation of heparan sulfate. So, it's not caused by environmental factors or diet, but simply by inherited gene mutations from the parents of patients. So both parents having this recessive gene means that 1 out of 4 of their children are estimated to get the disease, so about a 25% chance if both parents have the recessive gene. So next we're going to take a look at physical symptoms. So we can see on this, coarse facial features are one of the first physical symptoms, so frontal bossing or a prominent forehead as we can see in the picture, and then full lips and a full nose, broad eyebrows, dark eyelashes, and then dry and rough hair. So these are all physical symptoms that can be seen as children with Sanfilippo continue developing. Next, we're going to look at behavioral symptoms. So first, we have hyperactivity and restlessness. So this is going to present itself as excessive movement, inability to relax, and fidgeting. Next, we see impulsivity. So this is just going to be seen as acting without thinking of consequences, which is going to result in risky or inappropriate behavior in the children. These are often mistaken for ADHD in early childhood just because they do present themselves as a lot of the same behavioral symptoms. Next is a poor sense of safety. So a lack of danger awareness in their surroundings and just not really thinking about that stuff. Next is a loss of interest in social interactions. So decreased engagement with peers, withdrawing from conversations or activities, just not really having or wanting anything to do with the social aspect of development. Lastly, we're going to see speech regression. So there's going to be difficulty communicating and reverting back to simpler speech patterns as their cognitive abilities are regressing. So next, developmental delays. So as we've seen, like delayed speech development, that's going to be a big one. Cognitive abilities deteriorate. There's going to be a delay in motor skills like walking or coordination. And since this is a type of early onset childhood dementia, as the disease progresses, the symptoms are going to worsen. So as children have learned to do these abilities, as they continue to age, it's going to start progressing backwards and things they've previously learned are going to be lost. As we can see, developmental regression as aging continues. So next is diagnosis. So these symptoms usually appear between the ages of 2 to 6, as we've seen. Firstly, urine tests are taken to detect high levels of heparan sulfate, the complex sugar those with Sanfilippo are unable to break down. These urine tests are effective at helping pinpoint a diagnosis of Sanfilippo syndrome because it directly shows what is found in excessive amounts in the body, which can be traced back to the specific enzyme deficiency. So while each of the 4 variations of the disease have slightly different enzyme deficiencies, they are all going to meet back at a common ground of heparan sulfate buildup in the urine, which is going to trace back to Sanfilippo syndrome. So genetic testing can also be done since this is a recessive genetic disorder. So next we're going to look at a progression of Sanfilippo syndrome. So the first stage we're going to look at is the early stage, which is the ages of 2 to 6. So developmental delays become noticeable in this stage. Normal childhood development is expected by parents and teachers as they enter elementary school, but it is soon seen that these delays are present. So slow development of language skills is a huge red flag seen in this early stage. Another is trouble understanding and following instructions, especially at the upper ages of 5 and 6 when children are introduced into the classroom environment. Next, we see behavioral and facial symptoms present themselves. So as children continue to grow and develop, the physical symptoms like prominent forehead, full nose and lips, dark features, these are going to continue to get more noticeable. And so then in this early stage is usually when diagnosis occurs. So second, we're going to look at the middle stage, which is the ages of 6 to 10. So cognitive and motor skills are going to progress in this stage. For cognitive, we see word and communication skills deteriorate. Whatever skills the children with Sanfilippo had been able to gain prior, they start to go backwards in their progress and lose what skills they did have before. Learning difficulties also present themselves, so as previously learned skills are lost, new ones are also difficult to acquire, leading to a more advanced developmental delays. So they just keep getting further and further behind developmentally, despite being in an environment where they should be progressing forwardly. So for motor skills, as motor skills and physical ability decline, the children become more clumsy with frequent falling and coordination issues. Lastly, in this middle stage, we also see hearing loss. So hearing loss and difficulty responding to sounds or speech present themselves in this middle stage. Lastly, we're going to be looking at the late stage. So we see detrimental neurological deterioration. So most children become nonverbal and they begin having trouble recognizing family members or surroundings, and there's a complete loss of independent function, so a parent or guardian has to help them 24/7. Next, we see severe mobility issues. So many children become wheelchair bound at this time due to muscle weakness and joint stiffness. Lastly, we see seizures become present in this stage. So many Sanfilippo children develop epilepsy in this stage, and it worsens or gets worse over time. So the average life expectancy of Sanfilippo syndrome is in the teenage years. However, there is some variation depending on which specific type of the disease the affected has. So for example, someone with type A, which is the most severe and fastest progressing form, is going to have a shorter lifespan than someone with type D, which is the rarest form that has a slow progressive rate. So next we're going to look at treatments available. So while there are no real cures for the disease, treatments are available to help manage symptoms. So according to the Sanfilippo Initiative, gene therapy and enzyme replacement therapy are the most advanced and promising treatments for Sanfilippo patients. So gene therapy, a healthy copy of the defective gene is introduced via a virus, so the correct enzymes can be produced in the patient's cells, thus helping correct the deficiency. So we can kind of think of this sort of like a flu shot. So when we get our flu shots, the flu virus is injected into our body so that our body starts creating this is antibodies, but in this case it would be enzymes to help fight that. So their bodies are going to start creating these enzymes to help break down the heparin sulfate. Next is enzyme replacement therapy. So the missing enzyme is injected into the cerebrospinal fluid, increasing the concentration of the enzyme in which the patient is deficient. So this does not change the underlying genetic defect that is wrong with them. So it's sort of like a supplement that has to be received regularly. Next, we're just going to look at the importance of intervention in early childhood. So the ages of 2 to 6. So the ages of 2 through 6 are vital for recognizing these signs and getting a diagnosis. So the early intervention allows for an improvement in the quality of life for those with Sanfilippo syndrome. So the earlier it is diagnosed, the earlier rehabilitation and therapy can be implemented to slow down the regression of physical and mental abilities. So the earlier we can recognize these signs and go get a diagnosis done, the earlier they can start like their developmental therapies so that the progression of their cognitive, mobile, all of these abilities, like we can slow down the rate that they are deteriorating. So lastly, this is my works cited, all of the books and websites that I use to get all of the information. Thank you for listening.